we live now? Yep. All right, I'll say it again. Hi, everyone. Welcome to the February edition of the Board of Health meeting for Thurston County. I'm Robin Vasquez. Should we go around quickly and do introductions? Let's do Board of Health members and then staff. So let's start over here.
Hello, I am Tanzania Zinsale Marshall.
Good afternoon, Ray Peters.
I'm in, sir.
Beth Harvey.
Robin Vasquez.
Heidi Cannell.
Gary Edwards.
Emily Klaus.
Carla Noon.
And online we have
Lynn Nelson, aloha. I'm joining you from vacation in Hawaii.
Thanks for tuning in on your vacation, Lynn. And let's do staff.
I'm Jen Freiheit, Assistant Director.
Yeah, there we go.
David Bain, Director.
Damiana Blamalik, Health Officer.
Alrighty, well, we have an agenda and the meeting's called to order. Can I get a motion to approve the agenda as posted?
Could I make one comment?
Yes.
First? I see this says 3 minutes if citizens want to make, and I was going to ask the chair of the board, don't we do 4?
County commissioners do 4.
Yeah, the only reason I even bring it up was maybe for just the citizens that come in, so they wouldn't be, what do you get 3, you get 4? That's the only reason.
Consistency.
Consistency, yeah.
I mean,
So I was gonna make a suggestion at some point, but that's okay. I'm in favor of it.
pending an
I'll make a
overwhelming
motion.
number of citizens where we would have to limit the time, I
Right.
think lining it up so that the Board of Commission, or the Board of County Commissioners and the Board of Health has the same amount of time for public comment makes sense to me. So noted for future agendas.
Thank you, Robin.
Can I get a motion to approve the agenda?
I would make that motion.
Second?
All right, it's been moved and seconded. Any discussion, changes to the agenda? Seeing none, all those in favor of approving the agenda, please say aye.
Aye.
Any opposed?
Aye.
Any abstentions? Seeing none, we have an agenda. All right, speaking of, now we have an opportunity for the public to address the Board of Health. I see no one present in the room. Do we have anybody online? Nope. Corrine Marson is
She's the fiscal director for.
okay, thank you. All right, so seeing no public comment, on to the next item on the agenda. So we wanted to have a quick discussion about the Board of Health Fiscal Subcommittee. We have one of those. And we wanted to share just a little bit of information about what it is, because we need to appoint new members to the Fiscal Board of Health Subcommittee. We don't have to do that today, but next meeting in March, we will be calling for people to either volunteer or nominate others. And we wanted to know what you might be getting into before you did that. So I wanted to see if Dr. Harvey wanted to share a little bit about
And Lynn.
how it was, and Lynn, how it was participating on the Fiscal Subcommittee last year.
Want to go first, Lynn?
I can. It was a new subcommittee last year. Can you hear me okay?
Yep.
Yes. Okay. And honestly, it was a pretty steep learning curve. And so I really commend Thurston County staff for starting us at 0 and getting us to 60 by the end of that time period. I think we're ready to roll moving forward with making some decisions. We were not in a decision-making mode, more of a learning mode over the last few months. So I think we're ready to move ahead, making decision and helping to set policy through the fiscal committee.
And the subcommittee meets once a month typically, is that right?
It was meeting every other week, but that was because we were in budget season and trying to get these amazing people up to speed really quickly. As a subcommittee, we can decide what we want to do. Because we're in an off-budget year, we have more space. So I will just put into the either, I think an ideal framework or cadence right now might be once a month for this group. And then we can escalate things as we get closer to a budget process down on the road. That would be my suggestion, that we look at maybe a once a month cadence.
Okay. So commitment of an hour, hour and a half per month until
Yeah,
we get
I
closer
think-
to budget season when it might speed up a bit.
Yeah, I think an hour and a half is probably a reasonable way to look at that.
Okay.
Yeah, and I mean, it was interesting to just see the complexity of kind of what you're having to manage and like the different funding streams and buckets. And so it definitely is a bit of a learning curve, but hopefully we'll have more time, so it actually can help impact, priorities or answer questions. If they're sort of like, we have this bucket, what could we do with it?
So we were short a member based on the size of the committee last year. There was 3 members to the committee. Obviously, I think you guys will have the opportunity, if you'd like to expand the committee size, that's an option you have. Now the board has expanded as well. It's a conversation you could have either today or next week, but I'm just noting that we have at least one spot that we need to fill from,
3 was probably because of not.
correct?
But now we could increase the numbers because we have a larger overall board,
Up to 5.
go up to 4 or 5 people.
So maybe my suggestion, and either the boards will, is to maybe see the interest you get next week. And then based on the interest, maybe you can decide whether you want to expand the committee or not.
If there's a lot of interest, I'm happy to step down too. So if there's more people that really, really want to do it.
It might be beneficial to have 1 or 2 of the folks that served last year, though, to
Yeah,
continue
I'm happy
on.
to keep going as well, but
Got all that knowledge.
I've got other things I can do too.
How many members are there on the subcommittee?
Currently 3, but because the board has grown, we could have as many as 5 without having a quorum.
We should just keep it at like 3 to 5, and then based on how many people want to do it.
So no matter what, it will be helpful to have at least one person to fill a spot that was previously held. Then yeah, we'll see if you guys add 2 more people or so.
Yeah.
Great.
All right, so look for that agenda item next month. Moving on to department items, we have the proclamation calendar. So as part of your agenda, we have a list of the 2023 Board of Health proclamations for each month. We also have the Board of County Commissioners proclamation schedule. And last year, the Board of Health reviewed the anticipated proclamations. The goal was generally to have 1 proclamation per month, because that's as often as we meet. But they don't have to be these same ones that we did in 2023. And so we also have a list of potential topics that occur each month in the following pages, things that might have been recognized in the past. So we can approve the proclamation schedule as it is, or we can make amendments to it. If anyone has any strong feelings about recognizing or issuing a proclamation on a topic that's not on the list.
So the information you have here shows the 2023 BOCC proclamation schedule. And in 2020, we pared that down, I think, a fair bit for 2024. It might be,
Yeah, then we might not have caught up to what you guys did.
yeah, okay, well,
I have that list if you want it. I haven't put it on my computer.
okay, let's see if we need it. It's good, we might need it. You can see the pages behind that schedule show kind of everything that, like, everything under the sun that people have proposed, or public health staff has proposed, things that exist, things that we could do. Some of these are, have never been done, and, but you can see so many of them are public health oriented from the schedule, so that's why we wanted to, the Board of County Commissioners tended to steer away from the public health related ones so that this board could maybe pick those. Because we have a whole other set of ones that people ask us to do that aren't public health related.
The challenge with doing just 1 per month is that there are so many topics worth recognizing, so gotta make some hard choices.
So I think for the board, at a minimum, in terms of your action step, you could just take what the schedule was last year and approve it again for this year. Or as a board, you could decide to swap a topic. So just in terms of, if you're looking at what your action is, you can take the existing schedule, which is great, from last year, or add or change things to it based on those topics that Commissioner Minzer mentioned as well.
we strive for one per month, but if one month there's 0 and one month there's 2, it's not the end of the world. If people feel really, strongly about one month that has 2 really good ones.
We did 2 in August of
Yeah,
last
we
year.
can do that.
because we
It's just-
Didn't want to have to make a choice.
A kind of goal is one per month, but that's
thank you.
flexible. Thank you.
I'll open it up. Does anyone have any questions about things that are not currently on here, things that they might like to add or propose for consideration?
I have something. I was actually looking at this earlier today and I don't know if there's something that exists, but I'm sure there is, about acknowledging like the homelessness crisis. I didn't see it anywhere on this list. And I don't know, like I said, if something exists, but I'm sure if we looked it up, there might be something. I don't know if people would be interested in adding something like that.
I don't know if there's a specific month.
November.
Is November?
November is National Homelessness Awareness Month,
Thank you.
and also National Homeless Youth Awareness Month, which includes National Hunger and Homelessness Awareness Week.
And we don't have a meeting.
Thurston don't have a meeting in November, but it doesn't mean that we can't, honor that in a meeting before or after, so.
I mean, when we talk about the social determinants of health, having adequate housing is a huge influence on whether or not you're able to have a healthy life. So I think it fits within the jurisdiction of this committee. So shall we add that for November? Even though we don't have a meeting, we'll have to figure out how we issue that proclamation if we don't meet in November.
Another idea, just if we wanted to try to capture it in a meeting, I believe that the Board of County Commissioners did a emergency resolution regarding homelessness, and I think it was in June 2018. So you could sort of do the anniversary of that, kind of re-up, showing what the county did and kind of reporting back on where we've come and sort of highlighting that past action of the board and kind of reaffirming that commitment. I mean, that would be a way to pick a date that had some meaning and could engender a good discussion, kind of as a look back on, what does that make, 6 years now?
Yeah.
Since that was done.
And something that I've spoken about with David is having a work plan for the Board of Health so that we have an idea of the topics that we're going to receive briefings about. So even beyond having the proclamation schedule in front of us for the whole year, but knowing what kinds of things we're going to get presentations on or that we would need to take action on. So that could be something we would add to the work plan, is actually bringing a presentation from staff on, if we issued that proclamation in 2018, what has the journey been like since then in the county? Like, have we made progress? What have we done? How have we spent money? So I like that idea of pulling whatever happened in 2018 and doing an update.
Because June is food safety composting, and we even missed the week, because the meeting's on the 13th and the week is over on the 11th. So maybe this is the year we swap out that one and do
Business
business
update,
one
6-year
update.
retrospective on our homelessness
Anniversary of the
efforts.
crisis kind of thing.
I would be remiss from my EH colleagues if I don't note that is the only EH specific week. So I would just say my ask would be to add to it versus taking away or finding another way to have an EH centric thing, just as a side note.
There's also October 10 is World Homeless Day. If that adds anything.
Okay.
In April, the Sexually Transmitted Diseases Awareness Month and the National Child Abuse Prevention Awareness Month are potentially topics that are sort of on the rise that it might be worth thinking about. For sure, we're seeing a lot of syphilis and other STIs at a lot of babies with it. And child abuse too. So I just don't know how long ago that was done. And I don't want to be repetitive. Just a thought.
Well, I think the board commissioners, that doesn't take away from us doing it too, is gonna do Child Abuse Awareness Month in April this year.
So being the new kid on the block here, what do we do as a board during these awareness days? There's a proclamation, education, events. So is there a standard list of activities that we try to do during those?
With my massive seniority of having been on the Board of Health for a year and a half, usually what happens is that staff will reach out to a community organization or nonprofit that does work in that area, right? If we're issuing a proclamation on like, uplifting trans visibility, which we did last year, we reached out to PFLAG and had them come and talk about their efforts in the community related to supporting people who are trans and some of the challenges that they're facing. So it's not just the proclamation, but it's also that opportunity to bring somebody in to provide education to us and to the public that's watching.
Great.
We do a photo and then promote that through the county, social media. And then if there's any community events, then we try to raise awareness about those.
Yeah, encourage people to show up for those things. I've heard addressing homelessness maybe in June, heard April for STI and child abuse,
And
or,
sorry,
okay.
priority.
I've heard that we don't want to lose track of our environmental health colleagues, so maybe keeping that topic on the list for June as well. And again, we can't have more than one proclamation per month. Are folks seeing other things that they'd want to address or call out?
Yeah, I have one. It's listed under January though, the National Human Trafficking Awareness Month. I feel like that's an issue in every community and one that we can always learn from.
Well, we can flag that already for next January, since all of you will be on the board next year as well.
Okay.
Yeah.
So what have we got currently on the list? So we kind of missed our window for February, since here we are. We don't have a proclamation today. We're doing this instead. What we could also do is we could approve the proclamation for next month and then finalize the schedule for proclamations during our next meeting. If we wanted to give people more time to consider proposals to amend the schedule. I think some of you are kind of wrapping your minds around this for the first time, and I don't want to rush the process.
So what is the process to approve, like Emily suggested, a homeless awareness day? Is that just a matter of the board bringing it up and making a motion second, recognizing a day for that?
Yep.
Okay.
Staff would prepare the proclamation.
Yeah, the sort of back end work will be, that the public health staff will, once we know what the decision is for the month, the appropriate division or staff will then make the connections and prepare the resolution and kind of make sure that we're ready for that day. So, it helps us on the staff end to sort of have a sense of this so we can be planning ahead too, as well. Some of these we've been doing for years, so folks are kind of, like, I'm telling you an example, immunization awareness is something we've done for years, and we kind of have a good, we kind of know our partners, and some things are new, like Trans Visibility Day was, I believe, the first time we did that was last year. And so we're always open on our end, but it just helps us to have some prep about what we're gonna do.
One other thing, Ray, somebody, either all of us or someone usually reads the proclamation to the public too.
We've done it two different ways, where the chair would read the proclamation, but we'd also started going through so that each member of the board read a piece of it so that we all speak. So that's how we have been doing it for much of last year.
I think it's a great idea to give us more time. Yeah.
So could I make a motion to, you were suggesting that we have a March decision and then, okay, so could I make a motion to select Trans Visibility Day for our March proclamation and then defer decision on the rest of the calendar until the March meeting?
I would entertain that motion. Is there a
Second.
Moved and seconded. Does anyone have any comments or Speak to the motion at all? No? Okay, well, then there's a motion on the floor to decide on the proclamation for March, which will be the Trans Day of Visibility in March of, that's for our next meeting. And then we can decide on the rest of the proclamation schedule in March. All those in favor?
Aye.
Hi.
Oh, yeah, Lynn, thank you. Any opposed? Any abstentions? Motion passes. Thank you. You're gonna have a little bit of time for finalization of our proclamation schedule during the next meeting. All right. Moving on to an exciting topic on our agenda, strategic plan development.
Right. Are we ready?
Yes.
We're gonna have some fun.
So excited.
So exciting. All right, well, I know there's some groans, time answer, there's some groans in the audience, but we're gonna make this fun. We're gonna make this fun. If you're asking, why is Jen up here? Just a little bit of background. When I left public health for a brief stint in order to get my doctorate, I had an LLC. And much of that LLC was doing community health assessments, community health improvement plans, strategic planning for cities, counties, urban, rural, fire departments, health departments, students, universities. So I perfected, hopefully you agree, a shortened strategic planning process, because you'll see often those of you who have participated in them before, they're long and drawn out and many months, and people feel they have to talk to every partner and every constituent and whatnot to get information. But a strategic plan is really an internal document to help guide you as an entity, the Board of Health. So it's really driven by you, led by you, and so that's why we can shorten it. We can make it through it tonight. So I ask for your attention and to go through each of the components of that tonight. And it's going to be interactive, so speak up just at any point, and we'll get through it. So any burning questions right at the start that you have?
Did you do the one for 2020?
I was not here then, no. Yeah, was there a strategic plan for the Board of Health at that time?
It was
2018.
For the department.
for the
there was-
department.
The
Yeah.
department has one, yeah.
Yeah.
And you know, a lot of public health across the country, strategic plan is one of the base 6 plans that every health department has to have. And they're typically done every 3 to 5 years. I am a big proponent of them not being done for a 3 to 5 year plan, because then they sit on a shelf. All too often they collect dust. So the whole key purpose of this today is, can I click or can you go? Is to do a mini strategic plan, thank you, Linda, that is 2 years, so therefore it's in line with the biennium budget cycle and schedule, and it'll be very actionable. The new Board of Health clerk will keep it as an agenda topic to make sure things are happening. Oh, thank you. Scroll it. So a 2-year plan, 2 to 3 goals, and you'll hear me say a million times, this doesn't mean that all other projects and goals aren't important. This is just saying that those 2 to 3 goals that we pick are the ones that you will work on and ensure that they get done within 2 years' time. So that's why we want to make them actionable. And then after tonight, I will have something to be able to put into a work plan, which will feed into the work plan you were just mentioning as far as having presentations, which goals and strategies do they align under, so that every single component that you're working on as a Board of Health will feed into the strategic plan. So does that help? We'll have something for next month, hopefully, on the agenda that you call review and then move forward with as you wish. Does that make sense? 2 years, 2 to 3 goals. Next month it'll start. You good? All right. Oops, backwards. All right. So thank you all of you who did the survey. I appreciate that, because that's going to save us a lot of time tonight. So what I did was I took all of your words and I synthesized them down to what sort of stood out, utilizing the, oh, thank you. Can you see? Utilizing the sort of a thesis model of synthesizing down to what are the topics that emerged, right? And it was really clear from all of your answers, and you'll see your own words in here. The whole presentation tonight, none of this is from me. This is all your words, things that you contributed to, are really the people, the environment, and the local government. Those 3 themes emerged really prominently. So I took some of your words and basically put them in, and I won't read all of this, but let me scroll so you can see all of it there. Were these 3 categories as far as what's good about our community? And the reason why I ask this question is because we want to keep this in mind when we're choosing vision and mission statement, because it's why we're all here, right? So this was, any surprises here? Anything that shocks any of you? Does it fit in line with what you all said in the survey? It was really clear. It was really clear these 3 themes came out. So we can always return to this because this can help feed when we get to some of the goals and strategies. Another question in this survey was, what is good about public health and social services, essentially? What are the positives? And all of these things also came out as far as the positives. So we have what's good in the community, what's good in the department. These will all feed into what do we want to work on, what do we want to capitalize upon that's already there, that's already working and good in the community. And you have this in your packets, right? Just in case you want, if I go too fast? Do not. I don't. We'll make sure you get it in for the minutes or whatnot. But we can always return to these slides. I had also asked, what are some areas for improvements, or we're gonna categorize them as opportunities. So you will see here, and you'll see a parentheses with the number after, 3 people basically said that communication to the public, media presence, was something important that the Board of Health could do. The second one sort of follows right along with that as access to resources, more communication to the public. So you can see right from the top there, 5 people said this is an area of importance. And you'll see some of your comments in here as well. Further down, you can see options for the un- and underinsured, programming, funding, and you'll see 2 people said each of those. And down at the bottom, I listed things that were one person said. So it doesn't mean they're any less important, it just means only one person commented on those things. I see some laughter, that's awesome. What stands out? All right. So I'll give you just a minute to look at these. And I'm going through fast, so tell me if you want me to return because.
You want us to comment now as
Oh,
you're
you can
going
comment as
down?
we're going along, absolutely. If you see anything that stands out or you want to explain that maybe you see your own words.
Well, I
or-
think we're real compassionate. That's on your other slide.
Yeah.
I think we're too compassionate sometimes.
Yeah,
We try to take care of everybody's problem for everything.
that
But we
is
are
public health, yeah.
compassionate, and that's why we do that.
Right. So these track with what you hear in the community, with what all of you said, and these will all come into play as we get into starting to choose mission, vision, goals, all of that sort of thing, as to what you have all agreed upon and said are opportunities. I also asked in a little bit different way, you saw that there were some questions that I asked in different ways, was what needs to change? And the reason for that is because sometimes different answers are elicited. And you'll see here for this particular question, which was also areas of improvement or opportunities, were a little more specific things like crisis response staffing or substance use disorder case management. So some more targeted topic specific information came out from this. Now, you'll see the top one, searching for grants, 2 people said that, the rest were all one person with each of those. So again, we can come back to this and pull from this when we get to choosing what are going to be our 2 to 3 goals for the next 2 years. So begin thinking about that now, jot down some notes if you want, and we can refer to that. So jumping in, we're going to jump right in. We're going to do some work. The Board of Health has never had a vision statement, and I wanted to point out some famous ones because this is the fun part. All too often you see companies that conflate the vision and mission statement. Sometimes they'll list the mission statement first, which is actually wrong. You want to always have your vision statement first because your vision statement is like the North Star, the thing that's almost unattainable, that you always want to drive toward. It's that verbal picture. Am I doing it wrong?
No, you're fine.
She's gonna scroll over so you can see all the words.
Okay, thank you. So I just wanted to point out a couple of these. I'm going to jump to the second one down, IKEA. It says to create a better everyday life for many people. And you think, furniture company, why are they creating a better everyday life, right? But it's the vision statement that they want to achieve. It's the far off. And they're gonna do that by making furniture that's easier to build. Remember the days when IKEA was really hard to build, right? But they wanted to make life better. So that's their vision statement. I always use Nike. I like Nike because the second part, if you have a body, you're an athlete. That is some genius marketing, right? Because, well, I got a body, so if I go buy Nike, I can run like Prefontaine. So genius marketing, right? So it's an inspiration appeal to the consumers. Marketing, right inside its vision statement. Nerdster, what I always try to gear people to for vision statement is that tagline, the thing you can print on the coffee mug and the hat and the t-shirts and all that sort of thing, because then you get the community knowing what your vision statement is, and they remember it. So a nerd for all your needs is Nerdster. And then choosing the Alzheimer's Association, a world without Alzheimer's and other dementia. So this is really, again, is that North Star, right? Will we ever have a world completely free of? Likely not. However, this association is always shooting for that. So that's why we want to make sure it's okay to go for that unattainable, what's the North Star sort of vision statement. And then Patagonia, this is a different example because they're actually making a political statement. They're going to work on the environmental crisis. You're thinking a clothing company, but this is their vision statement, how they want to utilize their business through their vision statement. Which ones do you like? Which ones stand out to you? Any?
I like IKEA.
Yeah.
Second one down.
So these are just to spur your creativity, because next we're getting into choosing the Board of Health vision statement. So this is to get you going, get you excited. We'll choose your vision statement. And in the survey, I asked you to give me some proposed vision statements. Now, some of you gave me something that was a little more mission statement-y. So if you don't see your words up here, it's because I put it over in the mission statement slide that we'll get to next. Some of you had things that were very similar, so I might have merged them together. So it might not be exactly the words that you had, but these 4 vision statements are what came out of the survey that you all submitted. We don't have to choose one of these 4. We can completely scrap and go with something new. We can take one of these, maybe you say, I don't like the word thriving, I want to put collaborative in there. We can alter them, mash them together, choose something new. The point is we need a vision statement. Why are we here? What are we trying to achieve? Haven't had a vision statement before. And visions change and mature. So this doesn't have to be the same vision for the next 20 years.
You just want us to start
I would like you to
filling
start
stuff
just
out?
tossing out. What are your thoughts? I like number 1, or I wish number 2 was different, or whatever.
I like, oh, go ahead.
No, I was just, I'm just gonna say, what, do you want us to blurt it out? Yes.
However you want to do this. We can
On
make
the
it
same
fun.
page. So I like number 1, but I would modify it, because I think who's speaking and who we're talking about is important. So I would say empowered and united, empowering and uniting our community for a thriving future. So change it to active and about us.
I think united community is really important. I also think it sometimes can fly in the face of diversity. Don't have to all agree. We all just have to be happy here. So I don't have a suggested change of wording. I just want to think about
People creating a healthy community.
We can add that as another option.
You want a short one?
I'm a big proponent of having shorter vision statements so that it's really something the community can remember, as opposed to the very long ones that lose their panache. Thanks, Rob.
Lynn, you got something?
I do. We're a board of health, and I want to see a vision statement that centers around health, healthy community, healthy people, but that word needs to be in there from my perspective.
I agree with that. Like the first one for me doesn't work, but a thriving future is not sufficiently connected to health.
Mm-hmm.
It's too broad.
I like 2 and 3.
Yeah, me too.
Like, I almost think everyone living happy, healthy lives or something like
Yeah,
that.
creating happy, healthy lives. lives or something like that. Just something short you can put on a coffee mug.
Because really, we want everyone, as many people as possible, to be thriving and happy and healthy.
Promoting healthy, happy lives. I think Dr. Beth's got a better idea, because she already started off with a happy card.
She's got us in our feels.
We all need a little bit of that.
Yeah, gotta have a little happiness and love. It's all good for you.
So we're leaning like 3-ish. We can modify it. Leaning 3.
But I don't know if we necessarily want lengthy lives at the cost of,
Yeah.
you know, like.
Lengthy doesn't fit
It
with me.
doesn't always mean good when you have Alzheimer's or you're dying of cancer, so.
I don't want to be malingering, I want to be happy. I
Yeah.
like that substitution.
The word empowered has come up a lot in public health circles because it removes the act of the public health department or the board of health are doing things to people, that people are empowered to make their own decisions.
That's why I was using the word people, because it's an individual action as well as a group action from a board.
Everyone empowered to live healthy lives?
Healthy, happy, empowering, healthy, happy.
How about healthy people, healthy community?
Can I steer you away from that? The reason why is every health department in the country has that.
Really?
It's a very common one.
You want ours?
Dang, I thought I made it up.
I'd love to see you guys a little more modern and a little unique. I take that back. I won't steer you away. If you like it, we'll keep it. We'll keep it.
Yeah, it's like our vision for the community, like if we could have everything we want
If everything was perfect.
for the
Perfect.
health of Thurston County.
I heard something like empowering people to lead healthy, happy lives.
Keywords, I was gonna say, like, check.
I like that a lot. Someone write that down.
It's really good.
Putting all the pieces together.
Sorry, my handwriting on the thing. To lead, did I hear? To lead healthy, happy lives.
Happy, healthy. What do you say? I think it sounds better.
Kai has a friendly amendment.
Empowering people to lead happy, healthy lives. You guys are good. Do we agree?
Good.
I like it.
We feel positive. I see thumbs up.
I like it.
All right, talk to us.
What do you
Yeah, what do you like?
I like everything but the happy. I feel like we're missing an opportunity to put another word there that's a little bit more informative, like of our body of work, of sharing community with folks. I mean, obviously, we want people to be happy because that's a part of health, like mental health, right? But it's a little hokey. It's just not as, I'm being very picky also.
Well, no, I mean, I
Stop
think
me,
it's a good, I think it's
What's
a good
another
comment.
word? Yeah.
What do you, like,
Not happy.
Shut
No,
it
I
down.
agree.
well, I
And
don't know.
that's subjective. Absolutely. I mean, so is healthy. But no, I like it.
I have two thoughts. How do people feel about putting fulfilling there is my first thought. My second thought, I thought I would say this before we get to the mission piece, because it might be more appropriate for the mission, but what about addressing equity somewhere? I mean, this is kind of our North Star, you said, for the vision. So, and I don't know, I mean, I wish equity wasn't such a North Star concept, but sometimes it feels like it is. So I don't know if we want to put it in the vision or if it's something that would be more appropriate to put in the mission. But I think a lot of our public health crises are, I mean, I haven't heard one that isn't connected to equity in some way. So I think that it definitely is relevant to what we do.
And it can go in either or it can go in both nicely, right? Because it is the everything, right? So is it what we're trying to achieve, and then the mission can sort of also, how will we achieve that? So
Is it worthwhile to add the word all? I mean, because communities need different things. So if we're empowering all people to lead healthy lives, fulfilling lives, maybe, yeah.
Please do.
So, I mean, do you want equitable to modify lives, or do you want it to modify empower?
Mm-hmm.
So equitably empowering all people to lead healthy lives.
Ah.
I think the word all implies equitable.
That's what I was trying to get at.
Well, I'm gonna write it out, and you tell me what you see when you see it. How is that feeling?
In my opinion, all says it. I don't think we need equitable.
And if we say all here, we can certainly then relook at the word equity for the mission.
Because the mission kind of fleshes out what we mean.
The mission states, how are you going to get here?
Right, yeah.
It's the rocket ship to say get to that North Star. All,
I don't know that goes together, equity, it goes together, it just doesn't sound very good.
It sounds terrible.
Yeah, it's clunky.
it doesn't print on a t-shirt very well.
Yeah, it's like, we want easy.
I like the word.
Yeah,
I do, right.
I like leading with equity, but the way
Yeah.
that it sounds when you say it out loud, it's like, yeah.
So if it was just empowering all people to lead healthy lives.
Yeah, we're accomplishing the
And
same
then
spirit of
diving
it.
into, right.
And then, yeah, and the mission may be a better spot to.
All right, I like it. For sake of time, we'll leave it, we can come back to it. We will do this for now. We will make sure we don't lose this as we move on to the next.
T-shirts are in print right now.
That's a coffee mug right there. The Board of Health, empowering all people to lead healthy lives. I like it. All right, all right. Good work. See, we make it fast, Ty. All right. Now, mission. Mission is your purpose. Why does the Board of Health exist? It's your purpose. It's also, like I said, think of it as the airplane, the rocket ship that gets us to the vision. So currently, the Board of Health does have a mission. I only had one survey respondent that said they liked it. And so we can keep it, we can modify it, whole host of other ideas. One thing I want to point out is many people with missions start with 2, and that's fine. It's an easy place to start, so I'm going to suggest we start there. We can always erase the 2 later. But it's easy for people to think about it to say 2, and I'm going to use the first bullet, improve quality of life and life expectancy for Thurston County residents. That's an easy way to sort of put it together. So if you want to look at each of these bullets, 2, optimize resources, services, and partnerships for Thurston County residents. It can be modified. It's just a way to sort of think about how can the mission statement be read out. So I'm going to give you a minute because I'm going to scroll down so you can see all of them. Because I think, yeah, the enable is the last one.
So can I ask, like, to maximize positive health outcomes, how is that different than a vision statement?
That's a very good point, because now that we've chosen the vision, we want to make sure that it passes the test, that the mission is what's going to get us here. So kind of think of it as the goals achieve the values achieve the strategies, which achieve the mission, which achieve the vision. So they all feed into each other. So we do want to make sure now that we've chosen this vision, what is going to help to get us there? This is the purpose that's going to be the guiding statement for the Board of Health. So shout out, what floats your boat? Looks like maximize positive health outcomes is off the table. We've axed one.
I like 1 and 6. Can you mush them together?
We can mush whatever you want.
Because I think improving quality of life and life expectancy is important, but it's also about a healthy community and systems that are ready to help.
I think number 2 combines those really well, the optimizing resources, services, and partnership, because that naturally should improve the quality of life and life expectancy.
To improve quality of life for Thurston County residents?
So basically, if number 2 were chosen, it would say, the way we're going to get empowered, all people empowered to lead healthy lives is by optimizing the resources, services, and partnerships. Or if we meshed, what did you say, 1 and 6, we could say,
The healthy community piece.
yeah, we could remove the healthy community because we have sort of said that, so we could say, systems who are ready to help improve the quality of life and life expectancy. So you could also add the word systems to number 2 if you wanted. You could have a four-part thing, optimizing systems, resources, services, and partnerships.
Oops.
A lot of the rest of number 6 is sort of the
Uh-huh.
extra words.
Makes sense.
What else?
Just for adding commentary, I don't know how I feel about these synergies. Like, I don't know if we even have time to try to break down exactly what that might mean. But I do like the part where it says, services that support residents to achieve their maximum potential. Obviously, we might want to put something in health, just because that then goes back to that word empowering, which is the first word in the vision. So we want to be, whatever it is that we're doing, we need to be not necessarily enabling, but providing people with the services and resources to lead, right? They are leading their lives. So they are the ones that need to be maximizing the potential of their life. And we're providing things for them to be able to do that. So, yeah.
So maximum potential is sort of a synonym to the vision statement.
Sort of. I like the services that support residents to achieve their maximum potential, or like maximum quality of life and life expectancy, or something like that.
What if we combine 1, 2, and 7?
Stab it out for me. I'll try to write it down.
Optimizing systems, resources, services, and partnerships to improve quality of life and support residents to achieve their maximum potential.
Pretty fantastic.
Thank you.
Synergy.
Okay, I got optimizing systems,
Figured it out.
services, and partnerships. What was the last half?
Partnerships to improve quality of life and support residents to achieve their maximum potential.
So Jen, just a question,
Uh-huh.
is this where we could incorporate equity?
You could.
Right.
And support.
Residents to achieve their maximum potential.
I'm gonna shorten it. Max potential just for.
Yep.
It's a long one. So we want to consider, is this what the Board of Health is doing? And again, for 2 years, or the mission can carry on afterward, but is this really the foci of the Board of Health? Again, apologies for my handwriting. And also think, does this get us to this? If the Board of Health is doing this, it'll keep moving the needle closer to what we're wanting in the vision.
As a outside looking in, because I'm not a member of the board, I would say you should definitely wordsmith the mission, but I think you do capture that dynamic. Like the mission and vision do connect. Like, I think you definitely check that box.
So let's break it down into parts. Are you optimizing? Do you feel like, just in general, optimization? Board of Health does that? Are you involved in all 4 of these? Systems, resources, services, and partnerships. If we break down this part, is that all Board of Health related? Yes, okay.
If we're listing those 4 out, are we leaving anything out?
Think about
And the Board of Health cannot be all things to all people.
That's a good response to that question. Is there anything critical that
Right.
we're leaving out?
Yeah.
is it policy development, assurance, and what's the third thing?
Policy assurance, and now that you asked me,
You can see it like the circle.
I know the circle. What is it, David? Policy assurance and.
So Jen, the only reason why I asked that question is when you start to list things out, you don't want to leave something
Right.
off there that somebody will say, what? You did list it.
I mean,
So,
you could fit a lot under
Yeah.
systems, but let's, okay, so we just want to check, are we leaving anything out from
Assessment.
before?
Assessment, policy development.
Assessment. Yeah.
You would.
But is the Board of Health really doing assessment? Right. So this is where's the lane, right?
Maybe in partnership with those who are doing the.
Right.
Right.
So that could be a good point. So improving the quality of life, I'm bracketing it out here. Board of Health. Is that part of the mission, improving the quality of life for the community?
I mean, I think so.
I think it's consistent with your vision.
I'm just playing devil's advocate.
I might be inclined to take that part out and leave the support residents to achieve their maximum potential, because I think if they achieve their maximum potential, that improves their quality of life.
So maybe maximum potential and then something after that, because that feels a little, or it sounds a little less related to the body of work that we are doing to help people get there. Like maximum potential could be looked at in so many different ways. I guess I'm wanting it to be very specific to our body of work and.
Yeah, the word that keeps coming up to me is access. I don't know if that would fit anywhere. in
And
there.
you know, I do have to point that out. I wasn't gonna do that right at the start, but one of the questions I asked in the survey was, what's your passion when it comes to public health? And nearly every one of you said something related to access. Like, one of you said, I think, access for substance use. One of you said access for youth or whatnot, but it was nearly all of you said access was a huge component of your passions. So that is also something to consider. So on the side, I'm just gonna put a couple of access, equity.
I have a thought. Part that we have bracketed out where we're not sure if we have everything, I think we figured out it was assessment that was maybe missing, but instead of listing out those specific things, what if we started the beginning with something about access and equity? I mean, because if you're improving access and equity, ideally all of those things would be improved. So maybe we don't have to list them out.
So instead of maybe to improve quality of life, can we say increase equitable access as the beginning of the phrase?
Equity, optimize, access.
Equitable access.
So close. So given that we are so close, I just wanted to point out, because strategic plan tables always get hung up on the through, which is technically a strategy. So kind of like you were getting at, what's the through? Achieve max potential through. I'm just gonna bounce ahead for just 1 second, because these are sort of the things that make strategic planning go along, because people wanna then add, what's the through? Through data-driven assessment, through equity, through access, through partnerships, through services, through resources. We could certainly, these were all your suggestions that came out from whether you put them in mission or vision, but they're the sort of through things: education and outreach, collaboration, access to services. We could certainly add access or equity in a longer mission statement through, choose one or two. I would not do more than two. Again, you can't be all things to all. We have to narrow down. We could also list strategies so that they're not part of the mission statement. What essentially comes out, like if you're looking at the website, it'll say vision, mission, strategies, which are clearly saying the strategies are how we're going to achieve the mission. So we can consider that as well too. So kind of like you're suggesting, we could pull these out and say the strategies are access and equity. And you could bring the systems, resources, partnerships, et cetera, down when we get into goals, so that we're not losing them. So we can always put them sort of aside and ensure that they're more notable that way. I see head nods. Let's take a stab at it. If we move over here, let's just for now put systems, resources, services, and partnerships. aside and remove them from being very specific here. We could consider these words for the mission statement. They could also become technically strategies. Optimizing support for residents.
What about like improve access to equitable lives and support residents to achieve their maximum potential?
Say it again.
What did I say?
Write it down,
It was really good.
Improve access to equitable lives? Is that what I said?
Did I have the word improve? Did you say improve first?
Is this being recorded? I don't know what I said. Improve access to equitable lives and support residents to achieve their maximum potential? Is that what I said?
Sounds like it.
Yes, it sounds.
Okay.
So we're taking out support residents?
No, improve access to equitable lives and support residents to achieve their maximum potential.
So we good with removing quality of life? I will just say it's it's a little bit of a passé public health term, to be quite honest. Social determinants of health have sort of overtaken that term, if you will. So we're no longer optimizing, we are, or we could switch out the verb. Improve access to equitable lives and support residents to achieve maximum potential. Takes care of these two words, and then we can always do the through, which strategies.
What is an equitable life?
No, that's what I don't understand.
Improve equitable access to supports. To achieve.
Yeah, I think equitable is, good, but maybe just putting access after it and then replacing lives with something, because that does sound a little bit.
And you got lives up here.
Improve equitable access to community supports.
Supporting residents through equitable access to achieve max potential.
But what's the access to?
Say that again, Jen.
Supporting residents through equitable access to achieve max potential.
Equitable access to their max potential? Is that really what we're saying?
I think we need a word that encompasses systems, resources, services, and partnerships. Just a single word.
Stick all those things back in there.
Yes.
Right.
Strengthen systems, resources, services, partnerships to achieve equitable access and maximum potential. I don't know if that works.
This is hard.
I know,
When
you guys
you-
are doing great.
when you
We're actually
and-
doing this really fast.
Yeah, when you announced that we are supposed to be choosing all of this tonight,
I know, but I'm gonna press you hard. I'm pressing you
Okay.
hard, we're gonna do this fast, cause it's gonna get done. Okay, strengthen, did you say all of these?
Yeah, systems, resources, services, and partnerships.
I'm just saying the big
Yeah.
four.
right?
SRSP.
No new acronyms. Strengthen the big four.
To
To achieve
improve.
or,
I think, and then going back to what Emily had said, I think that sounds good. We're adding back in the big four to then complete. We all seem to, or
But I think,
most of us.
I think the equitable access needs to come first. So strengthen equitable access to systems, resources, services, and partnerships to support residents achieving their maximum potential. So we're improving access to all those things.
strengthen equitable access to systems, resources, services, and partnerships to support residents in achieving.
Yes.
so.
Going once. Did you get my? Strengthen equitable access to systems, resources, services, and partnerships. Do we have any care about the order? In supporting residents. In supporting residents. Oh, now I'm back to to achieve. Yeah, okay. I know, right? To achieve maximum potential. Now, we'll clean it up. We'll clean it up.
Yes.
We like it enough. Yeah. We'll run it through a spell check.
I think that's a good mission.
All right. Would you like to choose 2 or 3 strategies? I would suggest we don't add them to the mission. We leave them as separate strategies. But again, the strategies then say how you're going to do this to achieve this.
You know, there's nothing to say we can't add to it later on, once we've been
Absolutely.
in existence
Absolutely.
for a while and kind of figure
These
out the game
change and
plan.
mature and grow.
Sure.
Absolutely.
So this would suffice for now and
Absolutely.
adjust it later.
Yep. These were all one-offs, meaning one person each said these sort of things. We don't need to add access or equity to that because we ended up putting it in the mission. How are you going to now achieve this mission? How are you going to strengthen equitable access?
I think we need some data.
I agree with that completely, and I was saying I like number 2, sends the equitable part.
Policy?
I guess it's a little.
Policy and program, or just policy?
I still have 150 million questions, but yes, for now, vaguely policy and program development.
All right.
I'm gonna advocate for education and outreach.
Isn't that kind of program development, or do you find that to be a separate thing?
It's also communication. Like, a lot of what we do is just informing people of the resources that exist or the programs that already exist, because
Okay.
people don't know. And then when they know, then they use them. So that's the hope.
And this is a space that boards of health are really delving more into, so policy.
I kind of like the forward-thinking innovation too, but I don't know if that's more than 2 years, so. But just sort of like, we have climate, we have to think about heat, air quality, you know.
And that can come out in goals.
Okay,
We can certainly, so we don't have to lose any of these. It doesn't mean the rest are not important. It means this is how we're going to focus over the next 2 years.
I think that's more of a goal, I agree.
But I would like to flesh these out when we have more time.
Yep. I know I'm pressing you fast tonight, but, so are we good with these 3? Data, policy, program development, education, and outreach for strategies? Good? Any heartburn? All right. See? I'm going fast. How are we doing, Commissioner Menzer? All right. We're gonna see, did we pass the test? So these are some self-check questions, really quick, is to sort of say, for our mission, does it clearly state the business the Board of Health is in? Does our mission, which I can totally rewrite, but strengthen equitable access to systems, resources, services, and partnerships, and supporting residents to achieve maximum potential? You don't have to answer these out loud. Does it answer the questions, who you are, what you do, and for whom, and why it's important?
Not to be difficult, but can I ask a question? What is maximum potential?
I'm a little. Or if there was something after it, I could be satisfied, but just it by itself is just a little.
Mission statement taken by itself doesn't, I know it's a coherent progression, but by itself, it doesn't even connect to health.
Or it, right.
Equitable access to what, and support residents' potential to do what?
Maximum
To
health
me, it's too
potential.
It's too vague, it's too disconnected from
Just stick it in there.
the Board of Health's
body of work.
Or you
right?
could put
Yeah,
health before the
absolutely.
four. Health systems, resources, services, and partnerships.
I don't mind the statement, but I just don't know what maximum potential, and I'm hearkening back to my,
It is a bit of a synonym of what you have in
Coaching
the vision
days.
statement. It's a bit repetitive of what's in the vision statement. It's a kind of another way of saying it.
Yeah, I think the chair mentioned adding health before potential.
Maximum health potential,
I don't know if
yeah.
that
gets us closer, but it
But
could go
but I
either
also think
place.
if you do the health before the systems,
Health systems.
resources, services, partnerships,
Either of those suggestions would help me.
then you would, support residents.
And this is where potentially we could say, if we were hypothetically, we could say the through and add the strategies into the mission. You can certainly do that. I initially had said leave them as strategies because our mission was so long. So it could be strengthen equitable access to health systems, resources, services, and partnerships in supporting residents through data, policy and program development, and education and outreach. So here's what we're gonna do for the sake of time. We are going to leave it at that, and next month, when we bring the work plan back, you can finalize or continue to flush it out. We will leave it at that for the sake of time right now, and keep thinking about it though. Just want to continue to pass the test. Is it broad enough to accommodate the current times? Can the mission survive changes in administration? Is it easily understandable to anyone who reads it? So you have the PowerPoints now. So continue looking through that. Does it pass the test? That's for a good mission statement.
I think the last point is critical. They all are, but
Is it easily
as
understandable?
it is easy understandable to anyone who reads it.
Yeah. As a member of the public who doesn't know anything about the Board of Health, understand what we're talking about.
Right. Continue pondering on that. As we move on to values, oops, wrong way. All right, values is always a hard one because people want to include everything under the sun. And if you look at companies, they'll have 12 values because they can't choose. And there's a feeling that if I leave a value off, that means we don't care about that value, right? So I just want to reiterate that although all the qualities are certainly desirable and might even exist at any time in the Board of Health, that we must search for and focus on our fundamental. What are the core? And I'm going to try to push you down to 2 or 3. We need introspection and a willingness to acknowledge that all good things are not necessarily essential to an organization or board. The small set that are fundamental to your culture and adhere to them without exception. Not to say that you reject all the others, and you'll hear me say that a million times, but that you know which qualities lie at the heart of who you are as a Board of Health. So, we did a Kuznets and Posner Leadership on the Line, if you've ever read that leadership book. We did their values. You didn't even know you were doing it. I probably was not copyrighted to do it. But what came up was uniformity. So I took some liberties because things such as justice, equity, diversity, and inclusion were all separate. And 7 people chose one of those 4 words. I mashed them together. That was the biggest value that came out. I mashed innovation and open-mindedness together because they, synonyms of each other. 5 people chose those 2. So at the total points, so using the points and the number of people that did things, 4 people chose communication. You'll see the ones that were 3, 2, and 1. I put 3 dots at the bottom because there were several others that were 1 person chosen, but they were under 25 points. So if I had included every single value, there would have been many millions of smaller ones here. But it was really clear to me that diversity, equity, inclusion, innovation and openness, and communication were almost half of what came out of the values you chose. So in my mind, these are 3 really great values. And again, it doesn't mean you're not honest or, have integrity. It doesn't mean you're not inclusive. We can almost add inclusive. That you're not effective. It just says these 3 or two, if you wanna just go with the top two, are the ones we're going to stick to no matter what. They're the foundational bedrock of the Board of Health. Thoughts? What are you thinking about this as you see this?
So you're treating Jedi as one.
We can separate them back out. I was just trying to look for synergies because when the chart came out with everything separately, it was just a whole bunch of a billion, right?
I knew if I said something about my synergy comment earlier, it's come full circle several times, so. Thank you all.
Thoughts? What are your thoughts? Of what rose to the top of the values for the Board of Health?
I am curious, your thoughts around Jedi being considered one thing, if you wanted to speak to that a bit.
Yeah, I mean, I think I selected some of the letters in there, but not all, because I don't know what diversity means when we're talking about the work of the Board of Health. Like justice, yes, inclusion and equity, yes, but diversity of programming, because it's not necessarily diversity of community, right? Because equity sort of speaks to that and inclusion. So I don't know that it always works to apply the word diversity to everything.
And I can certainly parse it out so you can see the stats without that, because I don't remember exactly how many people chose the word diversity over the people that chose equity.
Everybody's really quiet.
So do these jive with what you think might be the three foundational for the Board of Health values? Give or take diversity.
So,
Right.
so is this supposed to be like our values in how we do our work, or our values for community, or the health department, or?
Good question, and you can choose. The values should help lead to the mission and strategies, which help lead to the vision. So, meaning that when you're working on systems, resources, services, and partnerships, that these three are the sort of roadmap. That you're not forgetting these three foundational values to being able to achieve all of that. So if you are talking about writing a policy, if you're talking about programs that PHSS should add to their repertoire, does it have these three values in mind with it?
Or is it what we want to be?
What you're striving to achieve, yes. It doesn't say necessarily, we are there. It's not meant to be, we're the most equitable Board of Health.
Right.
But the values are what you, again, sort of what you're striving and ensuring that you're always keeping that as the foundation in all the things you do.
You know, I've got bins, it's quiet. Trust is a big issue, and I think that, like, doctors are the most trusted, I'm gonna say. I've read this somewhere. Politicians are probably the least. And I don't know where bureaucrats fit in there. But I think trust is a big piece of acceptance by the public, and I don't know how to make it fit.
That can become a goal.
But
How does the Board of Health?
boy, I think there is a big lack of trust right now. I mean, you can see that in vaccinations. Everybody's kind of, what's going on here? You know, but they do trust their doctor generally.
Well, actually, there's research, and it came out at the beginning of COVID, that especially in our marginalized communities, that government and healthcare are almost equal with the lack of trust.
Yeah, that's what I mean. That's what I'm talking about. So if the doctor says it, well, that's a little better deal versus something that us politicians might say. Just recognizing it as an issue, that's all.
I think that to carry that point forward, if community trusts us, we're able to be more effective.
For
Right?
sure.
We're trying to do good work, but if
Sure.
the community does not want anything to do with the Board of Health,
Yeah.
because we don't have that trust.
And that's where, if we think back to some of the opportunities, communication was a big one, right? And so if you're thinking, if we communicate more, then maybe the community would trust us more, right? So that could become a goal.
That was how I filled this out, actually. I selected communication as one of my high priorities because it helps with trust.
I was trying to figure out how you added up the points for diversity and trust. You ended up with 35.
Oh, I did lie. I did have 2 with diversity. Okay, so 2 people chose diversity as one of their top 5 values, because remember I said choose 5, add it to 100. So one person labeled it at 15 points, one person labeled it at 20 points. So I
okay,
just
that's how
added
you
the
did it.
total with the number, which just populated the pie chart. Good point. So yes, so I'm so sorry, I just noticed that there. So if we did remove diversity, that's 2 less, you have 5, it's still on par with, you know, it's still one of your top.
I'm not advocating one way or the other, I just wonder. I just think trust is a bigger issue than we recognize sometimes.
I like that that's being brought up, and I think the chair brought this up. I think, or maybe it was you, Jen. I think this could be something that the board just holds on to. Maybe it's in the goals section, maybe it's in the strategy, but I think that I experienced it at the state Department of Health. I mean, that trust piece is huge, and if we don't have it, you know, our ability to do any of this right is,
We
is
can lose our
meaningless.
effectiveness.
So I do think it is a value, but I'm wondering, it almost feels like it's something that is, there's some sort of aspirational, something we're striving for, right?
Yeah, just make it actionable.
Like, would the value be maybe integrity or something? Because
Yes.
we can't say as a board, I mean, we could say we value trust, and that's true, but if we don't feel like the community trusts a Board of Health at this point, then we need to operate with integrity to earn that trust, and trust could be the goal, maybe?
Yeah.
I like that a lot.
I think
Yeah, I agree.
I like what Robin said in regards to diversity doesn't fit really, because I think it's answered in justice, equity, and inclusion. That creates trust, and communication, transparency.
I see what you mean.
So,
So if we remove diversity from the first one, so what's 115 minus 35? Somebody, who's got their phone out?
80.
80, exactly?
Yep.
So that would still be 5 people then that chose this category at 80. So your innovation and openness, which I think was something earlier, we mentioned innovation at some point, or forward thinking. So I mean, you get your forward thinking here. So this would be the number 1 value, innovation, open-mindedness, or you could remove open-mindedness. I mean, we can slice the pie any way you want to slice it.
But basically, the category still stays in the top 3.
Yep.
Right. We still care about equity, innovation, communication.
I also think open-mindedness and communication align with trust in a lot of ways. Because, I mean, if you're hearing things from other people rather than telling things to other people, you're learning from that. You're open-minded, and then you're increasing trust because you're learning something new, something you didn't know before.
And like communication and transparency also are very connected.
And we could combine those. We could combine those.
Transparent communication.
Yeah. Because it's really subjective. It's what value people chose, right? So that's why I took liberties to merge. You can certainly merge. Transparency was 2 people at 40. Yeah. So
My top value is stewardship is on there. I might use the word sustainability, but to me, a fundamental value has to be that you're looking generations ahead as you're guiding, you know, light for your pulse. That's a value of that has to be to me. Because if what you're doing is not, if what you're doing is creating a reduction in ecological health and in physical health, then it's not a sustainable course of action. So that sort of looking ahead, for me, has got to be a top value.
I think about the mission of the Thurston Regional Planning Council, whose scope is entirely different than this body, but they talk about their mission being over the course of not years, but generations. Like there's something to be said for public policy that stretches over lives, not just seasons. I don't know how we build that in, but.
Is 4 too much on the value front?
it gets to be a lot.
What are you thinking, David?
I was just hearing what Commissioner Mintzer was saying and thinking through. I think to Jen's point, they don't have to all be listed for us to still hold on to that is important.
Right.
Fair enough. I mean, sustainability as a word has gotten overused, but it's embedded in it. It's such an important concept that I don't, until somebody gives me a better word, I'm gonna keep saying it because it's so important.
Oh, did you say stewardship or were you sustainability?
Stewardship might have been the one I put down, but their sustainability works almost better because it's talking about that.
Let's put sustainability here just to consider it. Ugh, ignore my handwriting. Okay. We have a lot. Yeah.
Not to go backwards, but I think Commissioner Manzer brings up a really good point about sustainability, and we're talking about generations to come, and I'm thinking, I don't know, personally, I feel like it's important enough to maybe use generations to come to kind of wrap up the loose ends in the mission, maybe. I don't know. I feel like it's really important and maybe should be centered more, and that might be a good place to do it. Like, we could end the mission with generations to come. Not to nitpick the mission, I know we're already past that part, but.
Nope, it's fine. This is perfect.
Does that then, I do like that, would we remove our big four and set them down as like goals then? Like, because, does that make sense? Like,
I think so. You want to make
keep
sure the
that.
mission is how you're achieving this. If you remove the big four, then it's a bunch of fluff words.
Okay,
So the four really do, it's a lot, but it really does say, well, how? It's the purpose of why you're here is to achieve that vision statement.
Jen, if we were to settle on values, do we get to describe what we think they mean?
Oh,
Or is it
absolutely.
usually- Okay, good.
And that we were not
I would
going
want
to do
that.
tonight, because I at least wanted to just get us as narrowed down as possible. So you could, I'm so sorry, like if you're wanting to define this, you could remove the word open-mindedness, just because it was a value that I lumped together. Like, you could just stick with stewardship or innovation, right? And then when you're defining it, say, it includes open-mindedness and stewardship, blah, 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 right? So you could
Yeah.
tag things in that way. Because I would recommend, let's say you just choose this one word and this one word, but you're being inclusive of these other words when you define it. So what I will do in the work plan is meld it together from some of the things you put in the survey, and then you can pick at it from there. Are we good? So we can merge transparency in, can we agree on innovation, equity, and communication with merging these other key points in a definition? Yes.
I want to follow up on something Ray said about making sure it's understandable. There's an old principle that I used to hear a lot. It was called KISS. Keep it simple, Sheriff.
That's what I'm trying to get.
Keep it simple, Sheriff. So
Sheriff.
if you've got 4 or 5 letter words, everybody understands love and happy, and I'm just saying,
I get you.
keep it simple.
Yeah, if we could run whatever it is
It's,
we write through like the Hemingway editor or something to make sure that it's
Readability.
concise and,
Like it?
yeah.
That's really smart.
Like it? All right. Good enough for now. We'll pick it apart later. Okay. So we will not run through the whole thing, but this was really simple, so I think I'm hoping it'll be easy. Asked about some goals. These were the ones that really came out, really the top 3. So build and strengthen community partnerships to enhance collective impact strategies, which is a little more vague, but you can get more specific in the objective, because what will come out that we won't do tonight is the SMART objective: specific, measurable, attainable, realistic, time-bound. So innovate through evaluation, research, and quality. 5 people suggested that be equal. Assess and monitor population health, 4 people. So these come into, obviously, if you're assessing and monitoring population health, you're really focusing on this strategy that you set. So you want all of the goals to feed up through what you've set up here. It jumped out at me because you were very uniform in thought. that many of you said the same thing. So to me, it was pretty clear. Goals can be a little more vague, so as they're written, they're not bad. It's in the objective that more specifics can come. And like I said, we won't do that tonight. I'll toss some things in the work plan that you can all tear apart later. The fourth goal was develop a trusted brand and increase visibility.
Yeah, I wanted to highlight that for a second, because
Yeah.
that,
Speaks to trust.
yeah, this is kind
And
of.
it speaks to the communication part of.
And I'm trying to walk a line here as the public health director, because you guys as the board need to have your own thoughts and ideas. But I would say, if I'm looking at these four pieces of these goals, if we don't do that fourth goal, it does feel like the other ones are tricky. Our ultimate strategies are tricky. If there isn't a focus on the board, and if it's not here, it's okay, but this idea about visibility and trust, I think is just a thing that seems like the board needs to put attention to. And I think the department has the same need as well, so I think I'm projecting a little bit. But I'm just wondering if, as you're thinking through these, I know the other three have higher amount of marks, but I'm gonna just plug that there's something about this through line that the board should consider.
And 1 and 4 can be melded together, right? So you could think about doing that increased trust and building the brand through partnerships, right? And then the objective could come out something very much more specific and measurable related to that. Because I will really try, because this is only a 2-year strategic plan, to press you on 2 to 3 goals. 4 will be a lot to bite off. So if that means we meld and get more specific through the objectives, then we can do that.
I was just gonna point out that, we were talking earlier about the assessment, policy development, and assurance. And the first 3 goals are kind of those things, right? We've got assess and monitor population health, innovate
The
through
language
evaluation, research,
specifically
and
came
quality.
from that wheel.
Yeah, and then build and strengthen community partnerships, so like, those are the 3.
Yeah.
But developing trust with community, like the relationships piece, which isn't directly spoken to in that wheel of public health, is part of our job, I feel like.
That was a big thing that came out of COVID.
That could, I think Jay made a great point. It's a really good point, which is maybe some of the board considers either adding to one of these, probably the first one,
Embedding it.
or maybe it gets maybe it is something that gets embedded in some of the objectives later. But I just wanted to highlight that, not to add a fourth goal, but to say I think that it's clear that this is a theme that I just don't want to get lost in the mix.
And it does tie back to the wheel. So could we merge 1 and 4 and have 2 and 3, so we have 3 goals? How do we feel about that?
I think goal 2 and 3 could also potentially be merged. Because you're using the data from 3 to feed into 2.
Although I think when coming out with objectives, that'll be hard. Because 1 is strictly assessment, where the other is then using that data. So it is kind of our CHA versus CHIP, community health assessment versus community health improvement plan, right? It is kind of 2 separate bedrock pieces. And policy development, education, outreach can come through all of those. So that would come out in the objectives.
I could live with merging 1 and 4, as long as there's that highlight on trust.
See a couple nods. All right. So you've done a lot of really hard work in like just a little over an hour. This is amazing. Was I fast enough?
It was fast.
All right.
I feel
Pick
so
apart a
well
little bit later.
facilitated.
What?
I feel so well facilitated. It's a wonderful feeling.
We can pick it apart later, but at least then we'll step away. I'll type it into the work plan. I'm gonna show you a little bit about that. Next meeting, you can finalize flush if there's any flushing out. You'll have it ahead of time so you can be thinking about it as you brush your teeth tonight, right? All of these other ones that one person said, those can also fit under objectives and specific tasks and action items. So they will not be lost. I just wanted to make sure your words were not lost. We can do this little goal check later. This is, do we pass the test? So we'll check that next time. Then there's even further, do the objectives pass the test? We aren't doing objectives tonight. done a lot of heavy lifting and hard work. But this is sort of our check to make sure that we're meeting the appropriate definitions and standards. What will come for you next month is a typed strategic plan that is also a work plan, like I mentioned, that will come into play with the proclamations, the presentations, all of that comes in will feed under each goal and objective. So that again, we're not just having a presentation for the sake of presentations, we're doing it because it's achieving something that we set in our strategic plan, right? So this will come and it's very specific. It'll say who's doing what, by when, and how. This could play into future subcommittees that I know have been tossed around, a potential policy subcommittee, the fiscal subcommittee, that sort of thing as well too. Timelines, accountability. The new Board of Health clerk will hold you accountable. This will be a recurring thing on the agenda to say, are we achieving all of these pieces? So it all flows together. So this is just a really quick, I threw something together. You can see I made up stuff. But it's to sort of give you an idea of what you'll see next month in the strategic plan / work plan. Just the last couple questions that I wanted to ask because, again, we don't want this to sit on a shelf and be dusty. We want to keep it alive. So the clerk of the board can monitor, create progress reports. I'm guessing you might like progress reports. How often would you like to see those progress reports? Any thoughts?
Quarterly.
Quarterly? All right. Looking at Linda. Maybe Linda will capture it. Quarterly.
3 times.
All right. 3 times a year, is that what you?
I said twice a year.
They're negotiating.
Instantly negotiating.
We landed on 3 times a year. Going once, going twice, okay. How will you all communicate progress? It's the value of yours.
Group chat.
I think it's fine.
With the entire community.
Yeah.
Right? Old school way, newsletters, newspaper, internet, print media. Got your communications team over here. Introducing Alice, new member of the communication team. Sorry, Alice, I'm so putting you on the spot.
Calling Alice.
All right.
Have we done like press releases? Does Board of Health do press releases?
Yeah.
So additional press releases, all right. So how will you communicate progress? How will you disseminate the progress reports? What media will you use? It's your responsibility. You're members of the Board of Health. How will you do this? I know you're on many other boards and committees and groups, all that kind of stuff, right? And then how will you course correct as a Board of Health? Whose responsibility? How will we course correct if we steer off or need to adjust, right? Because it's fluid. It can change. It can adjust as we go along. So those are just some of the questions to think about. You did it. Good work. No, this is super important work. It definitely, it lands us somewhere. Why are we here? Right? So, good job. Excellent work. All right, that's it.
Thank you.
Yeah, thank you.
All right, so we'll have an update on this at our next meeting in March.
Yep. You will have a written plan to digest and
Finally.
I'm gonna see.
How do we communicate outside of this meeting if we have any feedback in regards to this, or some of the questions she asked, or do we?
I think if you wanted to send a message, you may want to send it to a staff person like David.
Okay.
Because if we send it to each other and we start having a conversation, then
Yeah,
we are
then
creating a
it's-
serial meeting,
Yeah.
which we didn't provide notice for, and so it's a violation of the Open Public Meetings Act. But if we communicate with the staff, then they can
So
share out
David
comments
gets to
and
be,
concerns.
yeah.
Yeah, so what, I think that's a great idea, and then, we are, in the process of finalizing the hire for the Board of Health clerk. And then when that position is set up, that person, I envision that person becoming your main point of contact.
Doesn't have
They'll
to be
report to me, so they're not like lost in the mix, but that person will be the best sort of department point of contact for you all. They'll keep things flowing.
I mean, I can bug Gary and I can bug Ty.
Oh,
you know,
and you should, definitely bug them. Absolutely. But yeah, I'd say for now, me, and then when we get the clerk of the board, we'll make sure you're accessible as well to you.
Thank you very much, Jen. Let's move us on to the next item on the agenda, which I think is our last item, which is Dr. A's health officer report.
Hi, good evening. I just wanted to start out by talking about viral respiratory season. So good news for the first time in several weeks. The transmission levels for COVID-19, influenza, and RSV are below the transmission alert thresholds. So that's good news, and we're continuing to monitor the situation. So you'll notice that I'm not wearing a mask at this point. However, everyone should be kind of thinking about their own risks, you know, whether or not they've become exposed to COVID-19 or another viral respiratory illness, or who might get sick if they get sick, and determining and making their own decision to mask. So there's still definitely respiratory viruses circulating, and I definitely support folks in making the best decisions for them and staying safe.
Can I ask you real quick on that? Since I'm getting on an airplane tomorrow, is that a place where, I mean, I know they talked about the air systems and everything. Is that a place where you would especially want a mask, or it's not as important as maybe other places?
So I'll share some anecdotal data from our investigations. So I can't speak to airplanes specifically. There's the HEPA filters. There are a number of different schools of thought of when the highest risk on airplanes is, and it's usually before taking off, you know, when the systems are at lower power, and then after landing. But what we are seeing anecdotally in the community is that travel is a risk factor for getting COVID. So that's, you know, when we do our investigations, we're seeing a lot of folks that have traveled.
So all the way through the airport and airplane, that would be a smart, probably thing to do, wear the mask.
So that's something that I personally do when I'm traveling.
That's what I want to know.
She's trying to tell you what to do.
Of course, it's like the location of the people around you, like how close are you to the person who's shedding, and you don't know.
All right, thanks.
And the good news is our COVID-19 hospitalization rate is still low. So 3.7 hospital admissions for COVID-19 per 100,000 for the week ending February 3rd. This goes along with our wastewater concentrations of COVID that a lot has and is surveilling. So that continues to downtrend with the most recent data from January 31st. One of the benefits of LOT, you know, engaged in wastewater surveillance is that I can share that the dominant COVID-19 variant for the week of January 21st through the 28th was JN.1, which is about what we're seeing. We're seeing it across the country as the dominant variant of COVID-19. There hasn't, you know, it is an Omicron subvariant, and the good news is that we haven't really seen a safety signal associated with that subvariant. We are seeing RSV and influenza downtrending in our county, which is good news. And across the state, influenza activity was low for week 5, which is the week of January 28th through February 3rd. So there's a little bit of lag time for data compilation. Influenza A is still the dominant strain in what we're seeing here in Washington state. So our trends overall are pretty neatly falling into line with experiences across the state. The reason why I mention influenza A being the dominant influenza strain that's circulating is that in some seasons, you can get a second bump of influenza towards the end of the season. Sometimes that's driven by influenza B. So that's the only reason. So we're tracking strains and overall transmission. I wanted to share a little bit about a recent food recall that the CDC shared information about. So there are, Rizzo Lopez Foods Incorporated has been, there's been a list of recalled products due to possible listeria contamination. So these include cheese, yogurt, sour cream, sold under a number of brands. Campesino, Casa Gardinas, Don Francisco, Don Pencho, Dos Ranchitos, El Huache, Food City, HEB, La Ordana, Rio Grande, Rizzo Bros, Rojos, San Carlos, Santa Maria, Tio Francisco, Trader Joe's, and 365 Whole Foods Market. So the list of recalled products, as you can imagine, is pretty extensive. So we just I wanted to take this opportunity to share this with all of you, as it impacts, our state and our community. Just to share that the guidance for folks is, if you have any of these recalled products, don't eat them, throw them away. And then, clean your refrigerator, containers, surfaces that might have touched the products. And if folks are having symptoms, so listeria, there have been outbreaks of it in the past. Listeria affects pregnant people, as well as people with immunocompromise. They're at increased risk of severe illness. Pregnant people usually have fever, muscle aches, and tiredness. And people who are not pregnant usually have fever, muscle aches, and tiredness, and may also get headaches, stiff neck, confusion, loss of balance, or seizures. So you can get severe infection from listeria.
Well, listeria can incubate for a long time, can't it? So you could eat one of these contaminated products and not feel sick for a week or two before it manifests. Is that right?
Yeah, symptoms usually start within 2 weeks, but there's definitely a lag time. But it may start as early as the same day or as late as 10 weeks after. So there's a wide range.
So if you're eating this cheese and you feel fine, that does not mean you should continue to eat it. You should still throw it away.
Yes.
You saw the same Facebook post I saw?
Yes, I did. Facebook post, I have some of this and I feel fine. Should I keep eating it?
Yeah, like.
No. Yeah.
You should not.
But for folks that are not, folks that have consumed these products and are feeling fine, they should just continue to monitor their symptoms. And if they start to feel, any of the symptoms I just mentioned, to connect with a healthcare provider for further evaluation. I also wanted to share that in Washington State, there have been several locally acquired cases of Candida auris, which is a fungus that's associated and has been noted in healthcare facilities in particular, and it's been identified in 2 Washington counties, King County and Snohomish County. The reason why I mentioned this is because we, through our partnership with the State Department of Health, are able to offer testing for folks that are identified as needing screening for Candida auris. So, for our hospitals, our long-term care facilities who want access to those resources can contact us. So,
How do you get it?
so often it is contact. We're still learning more about the extent to which it permeates environments, and it's been noted in the healthcare setting. We anticipate as we do more testing, we'll learn a lot more about its pervasive.
What does it do to you if you get it?
So you can get pretty sick with a severe fungal infection. The folks that were part of the outbreak were colonized. They didn't have an invasive fungal infection, which can lead to, in severe cases, you're looking at kind of fever, impacting your organ systems and potentially potentially death. So that's kind of that's what we're looking at. We're learning more about pervasiveness and the factors that might impact what leads some folks to have severe illness.
And the problem is we don't really have good treatment, right? Yeah, so it's a resistant bug that can cause you to be like in fungal sepsis. So,
What?
sepsis, so like septic shock caused by a fungus.
So
Always something.
I saw in the news last night bubonic plague in Oregon, I think.
I treated it in residency.
Hadn't been seen in Washington, it said, since the 80s. And it was somebody back then that was skinning a bobcat. It usually comes from an
Ours
animal.
was from skinning a rabbit.
Okay. But that was like something I hadn't heard from a long time. That
Well,
made
and
me think.
measles is back.
Yep.
3 in Vancouver, right?
So the way we usually communicate this is we have we have communicable disease updates that are geared towards our provider community and anyone who would like to sign up on our website for these updates. They do skew pretty technical, but and we've found that some of our community members like to stay informed. So if folks would like to receive these updates, just feel free to send us an email and we can get you included on this list.
And they're really helpful. We like them.
Is that all for you? All right, well, we've reached the end of the agenda. I had one item I wanted to speak to, a moment of personal privilege. I really like this room arrangement because it allows me to see people and you all can see each other versus when we're on the dais. Folks sitting way down at this end can't see the people at the other end and it makes it hard to have a conversation. What do we think about this layout?
There's 3 members missing tonight, so we'd have to
We'd have to make it a little bigger.
fill in the square, or,
Yeah, we did the U just because of the
okay.
location.
Okay.
Having
Lynn?
previously chaired, I totally agree and get where you're coming
Being
from.
able to see people,
Very
right?
difficult to even manage when we're in a straight line like that.
Well, and as staff of the department, the 2 of us can also sit over back here and you'd have,
Space.
well, actually you'd have 3 spaces. So I think you could pull it off, logistically, you could pull it off if that's the decision you want to make.
Does this work from a staff perspective? Because I've heard that this is the layout of the county commissioners' meetings sometimes
For agenda settings.
for agenda setting.
And all work sessions. Everything but our formal board meeting on Tuesday afternoon
Yeah.
happens in this format.
And the podium could still be.
I like this. Let's do this for next meeting. Anything else for the good of the order? All right, seeing none, thank you, everybody.
Thank you.
Our meeting is adjourned.